My name is Kundlas and I'm a primary care physician. In this video, I'll be talking about testing for BRCA1 and BRCA mutations. I have seen in my practice nothing provokes more fear in any woman more than if they come to know that any of their close relatives have these mutations. So I thought that I should create this video so that you should understand the steps which needs to be taken in order to ensure that you could navigate this healthcare system properly and you know which stage you are in. Usually, if you have been told by one of your family members that these mutations are positive, you should call your primary care physician and schedule a visit. And usually we go through following steps, and this video will follow the logical flow where you will go through initially screening questionnaire, then a little bit of counseling, sample collection, analysis, interpreting the test, and then finally creating action what needs to be done. Pre-test counseling. Before you go through genetic testing, you should meet your healthcare professional, and in most of the cases it will be your primary care physicians. These days, most of the reference labs have now genetic counselors. You could call them and schedule a visit. They will ask you series of questions where they determine the likelihood or the validity of the history which you have received from your family members. Then you will be explained in detail about BRCA mutation, your increased risk of possible developing breast cancer, ovarian cancer, and this mutation is also associated with other cancers in the body. You will be explained in detail about all the different diseases, risks and benefits. So second step is sample collection. In this, your blood and saliva will be collected, and it takes about 2 to 3 weeks for lab to analyze your DNA for these mutations, and then the results will be sent to your ordering physician. Usually the labs are improving and they do two kind of tests. One is called full gene sequencing, where your entire length of BRCA DNA is studied and the mutations are noted. And second approach is variant specific testing. If other family member have this kind of test done, then the lab will have a direction which specific genes parts they have to focus on. After the testing is complete, your physician or healthcare provider will get the results. So next step will be communicating the results to you. If the results are positive, you will be referred to appropriate specialists. If the results are negative and no harmful mutation is detected, you should continue aggressive screening and you should continue to be vigilant. Having a negative test one time does not mean you will not pursue it. Sometimes the result is not very authentic and we do not know the results significance. Even in those cases, we continue to monitor it very closely. Then, if unfortunately you are positive for one of these gene mutations, it is your responsibility that you must communicate this with your other family members so that they could use this information to their advantage, get proper screening, testing done in order to prevent this deadly disease. I hope this video will be helpful and you will know what to do in case you are dealing with one of these problems. Thank you very much.